Hi, my name is Shelby Davis. I'm a senior health studies student at Monmouth University. Today, my group and I did our presentation on the analysis of technological mobile application use in speech teletherapy environment.
Hi, my name is Breslin. I'm a senior at Monmouth University with a major in speech language pathology, and I'm from Shrewsbury, New Jersey, and I've been becoming a speech language pathologist.
Hi, I'm a sophomore at Monmouth University, and I'm double majoring in history and secondary education, and I'm aspiring to be pathologist as well.
In contemporary times, the rise of technology has influenced the way modern speech therapy is delivered among various client populations. Speech language pathologists have utilized technological devices such as iPads as a digital tool for service delivery and as a motivator towards interactive learning in order to facilitate speech language activities during therapy sessions. The COVID-19 global pandemic has brought an increased use of various mobile applications by SLPs. However, there has been a lack of research in examining SLPs' use of mobile applications for pediatric speech language therapy. This study investigates how SLPs use different genres of mobile apps and other digital tools to skillfully provide therapy to other different age groups of pediatric clients across various clinical settings. Example, schools, private practices, and hospitals, both in person and teletherapy. So as you see on this flowchart, what my research team and I have been doing is gathering research that has been done between an SLP and a client. And as you can see, there's different shaped colors, and have on the left-hand column, client characteristics and then it goes into examples. So every Friday, my team and I meet and we code based on all of these different categories, and it helps SLPs gather research for further knowledge. And this is what we create from the code book. It's called a persona page. As you can see, it's definitely much more organized from the code book. So we kind of color coordinate, as you can see, age, disability disorders, the levels of ability, clinical setting that the child and the SLP are in, clinician experience, and non-clinical focus. This really helps shape our research as well. So now, how does COVID-19 impact speech therapy? The emergence of the global COVID-19 pandemic led to more widespread acknowledgement on the accessibility and benefits of teletherapy. During the pandemic, schools, clinics, and other speech therapy facilities quickly reacted to this change by incorporating remote learning at home and utilizing video call platforms such as Zoom. This pandemic pushed SLPs and clients to rapidly shift from their in-person sessions to mobile applications, and impact of the pandemic has highlighted and stressed the pivotal role mobile applications play in pediatric speech therapy, from it being a motivational tool to being educational therapy tool as well. Although masks are a necessity to keep everyone's health safe, but it has created a learning struggle for SLPs to effectively carry out therapy sessions both in person and through teletherapy. So what is the qualitative analysis method? So as we saw before, our persona pages kind of highlighted 24 semi-structured interviews with SLPs and clients. We created clinician user personas to develop an understanding of the intertwined relationship between the clinician, the client, and app-based intervention. The findings demonstrated diverse techniques of how clinicians skillfully implemented and integrated various mobile apps. Some of these examples include augmented alternative communication apps, speech language apps, game apps, and utility apps across different clinical settings, populations, and ages. Many of these apps that are used in their practice have led to different perceived effectiveness depending on the client's abilities. The clinician's app and use techniques and apps for both positive and negative outcomes from the use of mobile devices and apps, and also offers suggestions for creating digital tools for teletherapy and in-person speech therapy. This study contributes to the established literature of apps used by SLPs and sheds light on multiple areas for future research.
The financial and economic effects are extremely important to the evolution of a child's educational career. These factors discussed in the persona pages include the access to technology, costs, budget, expenses, and purchases. In many cases, schools or individuals cannot afford the best options in technological devices such as computers, iPads, or even the apps themselves. The lack of funding and access to many resources can leave many students in an educational gap between other students that have the ability to learn from these resources. Moreover, the internet has revolutionized the number of knowledge people have readily available, so without these tools, the quality of education severely decreases. The SLP see firsthand the effect that the disparities between these students. In the interview, these quotes were significant to the economic and financial factors. So on P21, it states that those are the ones that you have to pay for. The quality is good, that I was willing to pay for both of them and download them on the personal iPad. So this quote was from a speech pathologist who was sharing their experience with the app that they were using. The socio-cultural factor adheres to the aspects related to social, cultural, and linguistic domains of both the students, educators, and diverse school districts. These factors could affect the level of education that a student might receive. Individually, a student with higher social economic standings might choose to send their child to a private school with more specialized attention rather than a general local public school with more children. Or on the other hand, a school might not have the means to buy these technological platforms and apps, leaving students at a disadvantage compared to their neighboring districts. Moreover, a student's home situation heavily affects the way they learn, and it is immensely important to foster these realities. After many interviews with SLPs, it was emphasized that each student is different and adaptable methods need to be created to best fit the needs of the child. Two quotes derived from the persona pages that we use where we had parents in jail, foster homes, and abuse cases, and that shows the effects on these students. In regards to both the ethical and moral stance when teaching students with SLPs have made educated decisions to ensure what they both are teaching, ensuring the students are honorable and correct. These factors relate to rules or standards that influence or govern clinical practices and clinical decision making. The SLP has the ultimate authority in how to carry out their methods, especially when discussing the technological platforms to incorporate. SLPs are willing or unwilling to show ad-supported apps to students that might contain objectionable ads. And finally, it is important to look into motivating factors that adhere to clients because it entices them to continue with the resources that are needed. These factors are shown to be facilitated and reinforced through the use of technological tools. The use of technological tools and apps is extremely beneficial and makes both the students, parents, and SLPs driven to continue the therapy session. Enticing the student with the individual interests can tailor the course of therapy and make the student engaged in the process.
The utility of technological mobile applications has grown over the years with technology becoming more accessible and incorporated into speech therapies such as teletherapy. There are various genres of apps being used for speech therapy ranging from speech and language apps to grammar apps. Some examples from the findings show two very prominent apps that were integrated into speech therapy sessions, such as Articulation Station and Tokaboka apps. Articulation Station is an articulation app which focuses on consonantal sounds in English language, and this type of mobile app allows for children to work on articulation with consonant sounds in different capacities, such as word level all the way up to story level. Additionally, the Tokaboka apps were consistently mentioned in the interviews. One Tokaboka app in particular, Tokaboka Pet Doctor, was a popular app of use among one clinician. App use techniques focus on how clinicians use apps to support speech services to clients and vary amongst clinicians, but it seems that there is a melding between traditional clinical techniques and modern app use techniques. As previously mentioned, one clinician found that the Tokaboka apps were very helpful, in which it was observed that preschoolers took pride in taking care of the animals in Tokaboka Pet Doctor. They took pride in feeding food to the animals, and it provided them an intrinsic place for giving them a responsibility, giving them a job and rewarding them for that job and building that motivation in them. Using apps for rewards seemed to elicit conversation, especially when, as one clinician observed, using apps with low functioning patients led to the evocation of greetings or short phrases. Apps can also be used to help provide visual instructions for pediatric clients who do better with understanding visual input. There was one clinician who used the YouTube app to show how YouTube videos
to kids and examples of how to play games, because a lot of children didn't know how to play games. The use of mobile apps has revolutionized the way clinical speech therapy services are delivered to pediatric populations. However, there's always room for advancing the overall design of the app. There was one clinician who provided a recommendation about app accessibility regarding children with disabilities and how there needs to be consideration of whether the system design of the app has appropriate accessibility options for the disabled pediatric population. Not all mobile apps used in the therapy setting are specifically designed for speech therapy, but instead, clinicians are able to modify and adapt the app to revolve around the child's therapy needs and goals. Another clinician brings up the idea of applying gamification theory, which pertains to using aspects of games and incorporating them into a tool utilized for speech therapy learning goals. However, the clinician states, "I'm yet to find an SLP speech therapy based app that has any solid grasp on gamification theory." Also, system design on apps need to be based on evidence and research when being created. Apps being created and targeted specifically for pediatric populations with disabilities based on no evidence nor research would do a disservice to the intended population. The same clinician who provided the comment on gamification theory also mentioned that an app has to be all three sides of the evidence-based practice triangle. It has to be the research basis. And in regards to app design and recommendation, the use of mobile apps in the clinical setting are meant to be used as a tool to help support delivering speech therapy services. Therefore, apps that are categorized as specifically being made for speech therapists should consider the feedback of active practicing SLPs. One aspect of app design that was commented upon was app simplicity. In one interview, a clinician suggested that some apps are way too busy, especially if you're trying to focus on one specific thing or one component. Keeping it simple or not a lot of flashing things that kids can perseverate on, especially kids with attention or autism can perseverate on. I think that's important. Also, there was a recommendation for more options and customizable user settings in order to better use the app for each individual pediatric client. The more available user options equates to better tailoring therapy services in regards to using mobile apps. In another interview, a clinician strongly stated that apps need to have a lot of options in terms of setting. Do you want voice? Do you want instructions? Do you need the instructions, etc.? Moreover, another key app design recommendation was the need for better interactivity within the apps. One clinician noticed that there was no way to cast my app and then let them interact with it still yet. So therefore, there still needs to be advances in app design toward better interactivity between clinician and client app. Overall, mobile app use in pediatric teletherapy has advanced the delivery of speech therapies, but there is great room for improvement in both app and system design to better serve the populations in need of SLP services.
Thank you for taking the time to watch our video. Again, this is our research team. Unfortunately, our mentor, Dr. Duke, wasn't able to come today. We all are thankful for her and all the time she's put into us. We work with her every Friday for a couple hours. We code, we work on personas, but I feel like I have a home away from home. I'm able to go on a Zoom call and do research and really enjoy and listen about SLPs and research and everything that I want to do. I'm grateful that I will be attending the graduate speech language pathology grad school here at Monmouth this summer. Can't believe it, and I'm so excited to continue all the research that I'm finding and hopefully apply it as an inspiring speech language pathologist.
To Monmouth University, I think on behalf of all of us, we're extremely thankful that we're able to continue our research amongst the COVID havoc and be able to present it to you, even if we're wearing masks. So we look forward to many more presentations in the future, and we thank you.
Just want to say thank you for allowing us the time and to be able to spread knowledge and awareness about teletherapy and mobile applications used in pediatrics and